We are going to become University Hospital Dorset. We'll be working together with our colleagues in Bournemouth. I think it's just creating that better opportunity to be able to serve our community within Dorset, you know, providing good, effective healthcare systems for them.
Being a merged organisation is so important that we are not in a position to offer the services that we would like moving forward. It's not sustainable to continue to try and offer high quality services in two organisations. That's why coming together as one organisation will enable us to provide a better quality service.
The changes that are coming as being good changes, I think it's difficult when you're trying to articulate what change is going to look like. People will always mourn for what they had. But I think you can use Christchurch Hospital site as a really good example, because there was lots of concerns around how, you know, they were losing their hospital. We were closing beds and moving things around. But actually Christchurch as a town has ended up very proud of what remains on that site, and actually there's an awful lot of really good work that's delivered there, and in fact we're expanding it again, but in a different way. We haven't got the inpatient base there anymore, apart from the Macmillan unit. But that was right for the patients, and that's still right for the patients. We need our sick patients near where they can be looked after when they're acutely unwell.
Emergency care, I think, has got a really exciting future as part of University Hospitals Dorset. And the key is getting people to the right place the first time, where we can deliver clinical expertise 24/7 with a sustainable workforce. I think there isn't going to be massive changes on the 1st of October when we become University Hospitals Dorset, to assure people it is going to be a journey of bringing services together, looking at what they look like, what those pathways or those patient pathways that you follow need to look like. And as we go along, we'll make changes.
Patients will get a better holistic care. They'll get the benefit of the good services on both sides, and in my department hopefully we can get an increase to our workforce from that perspective as well.
It's about having the right facilities, the right equipment, the right staff, the right expertise all the time, 24 hours a day. I'll give you an example in surgery. So currently, if you were admitted to a surgical unit in Poole Hospital or Bournemouth, there wouldn't necessarily always be a consultant around 24 hours a day, because there aren't enough of us to provide 24/7 care. But with the merger, we have the opportunity, because we have more consultants and we're all doing emergency work on the same site, that 7 days a week being admitted on Sunday will be the same as being admitted on Wednesday.
The great thing about merger is that we're going to become a university hospital. I see that as a great opportunity, not only to build up research opportunities, but also in terms of recruiting the very best staff and having a real high level of expertise to move forward, and hopefully keep us on a very high footing to compete very favourably with any other hospital nationally.
Yeah, so the link with Bournemouth University as University Hospitals Dorset is really, really important, not only from a quality perspective. The association between research potential and clinicians in the hospital is very clearly linked with better patient outcomes and better care, so a really good linkage there. But not only about our own improvement, but also the attraction to this area of a university hospital status is massive. So I think to get quality people into the area is huge.
It will open up doors. It's a status, isn't it? And you know, at the moment on the Bournemouth site, we don't have regional trainees, medical doctors coming through here that are on a trainee programme. With University Hospitals Dorset, my understanding is that'll open us up into the Wessex region, and that'll open up more training opportunities for people to come and do placements here, etc. I think it'll open up more research and educational opportunities, and I just think it's a really exciting thing to happen.
I see us being a learning centre. I see people come in here to learn from what we've done, and if we combine that with a culture of inclusion and with a very positive overall culture of welcoming people here to learn and to work, and our patients to receive the best care that we could give, I'm sure that UHD will be talked about as one of the exemplars in 10 years' time.
a trust with equity, a trust where, you know, people feel safe and they know it's a safe environment for them to, you know, really be who they are. Because when you get really great staff experience, you get better patient services, because at the end of the day, the staff provide the services to the patient. So ensuring that our staff are happy and proud of being, you know, of working within the trust, I think that will be a great vision.
Simply the best. No, I think I do think that ultimately, you know, we want the public to think that they're in safe hands, that you know, that we have got everything together, that we are working as a whole team, and that those concerns that there may have been around some of the changes, maybe around ED, and that those have all been taken into consideration, and that, you know, that they have that confidence and they can see openly that in a transparent way that we are there for the patients, doing our best.
I've been looking to see University Hospitals Dorset become a world-beating institution, and I think that's actually possible, looking at the people that we've got in the organisation and the ambition and the energy that I've seen. I would, you know, in 10 years, see us as one of the leading hospitals, one of the leading trusts in the country.
We want to be delivering a first-class service that works for our community and our patients.